Nearly 3 out of 4 people say that Medicare is confusing, which means 1 out of 4 are probably lying. Between the enrollment periods and the multiple parts, it's easy to see why. So let's break down the ABCs of Medicare with no complicated terms, no jargon, no fluff, just the basics. Here's the first thing you need to know: age and eligibility. You become eligible for Medicare right around your 65th birthday, and you might see this listed as the initial enrollment period, or IEP. But here's the thing that people miss, and what most insurance agents don't advertise. You've only got a 7-month window to sign up. That's 3 months before you turn 65, your birthday month, plus the 3 months after. If you miss that, you could face late enrollment penalties that last a lifetime. Its cousin is the AEP, the annual enrollment period, when people have from October 15th to December 7th to update their current plans. Now that we know about the 2 types of enrollment periods, IEP and AEP, let's get into the 4 parts of Medicare. They're easy to remember because they're the first 4 letters of the alphabet: A, B, C, and D. Now when you think of Part A, think A for admission. Part A covers admittance to the hospital and some inpatient care. Next, we've got Part B. When you think B, think basics. It covers basic things like doctor visits, outpatient and preventative care, and lab tests. Moving on to Part C, which we're going to remember with the word combo. Part C combines Parts A, B, and often D into one plan, and sometimes may include extra coverage for things like dental or vision. Part C is also known as Medicare Advantage. Because Part C is the combo pack, it often includes the whole kit and caboodle. But check with an advisor to make sure your plan includes the whole enchilada, or at least the extras you want. And finally, there's Part D. When you think Part D, think drugs. It covers prescription drugs, though it may not cover all of them, and is sometimes included when you enroll in Medicare Part C. Now that we've got the parts covered, let's talk about price. There are a few things to think about when it comes to what you'll pay. You've got premiums, deductibles, and out-of-pocket costs, just like traditional health insurance. And while Part A might be free for most people, Part B does have a monthly premium. And depending on which plan you choose, you can still have gaps in your coverage, which you'll need to fill with an additional policy, like Medigap, which is a Medicare supplement, or a solid Advantage plan. So it's important to make sure you have all the coverage you need. Which leads me to my last point: Medicare doesn't cover everything. For example, it doesn't automatically cover dental, vision, or hearing. So you'll need to look at additional coverage options for those services. Now, if you're like me, you probably have 14 follow-up questions for your personal situation. And good news for you, I can help get you the answers. Our friends at Chapter are here to give you clear, pressure-free guidance so that you can make smart decisions about Medicare without the sales pitch. Click the link below to connect with a Ramsey Trusted Medicare advisor at Chapter.